Hello everybody, my name is Adriana and the group I chose to focus on is special needs, specifically patients with dementia. Okay, first let's go over background. What is dementia? Dementia is an umbrella term for neurodegenerative disorders, and there are several subtypes. Symptoms of dementia include loss of memory, interference with other thinking abilities, and the declining ability to function normal in daily life. Individuals with dementia can develop mood swings and personality shifts. The most prevalent form of dementia is Alzheimer's disease. Alzheimer's is caused by damaged nerve cells in the brain, and the neurons that are first damaged are those controlling memory, language, and thinking. Here are some statistics about dementia. An estimated 6.9 million Americans 65 and older are living with Alzheimer's. Alzheimer's is the fifth leading cause of death in Americans 65 and older. Around 18.4 billion hours of care were provided by over 11 million family members and other unpaid caregivers. In 2024, payments for dementia health care, long-term care, and hospice services is estimated to be $360 billion. Okay, moving on to family and cultural considerations in EOL. According to Galvin and Sadowski in 2012, it is important for healthcare specialists to take into account the physical and emotional health of the primary caregiver because their health is a very important aspect of the patient receiving optimal care. It is known that caregivers suffer from increased rates of depression and physical illness, and family physicians need to monitor regularly the health of the primary caregiver as well as that of the patient with AD. Family members should be encouraged to work closely with the multidisciplinary team. It is important to provide emotional support for family members who are dealing with a wide range of emotions as their loved one's cognitive performance declines. Family members may begin grieving long before the patient passes away as they're grieving the gradual loss of the person they once knew, so it is important to have counseling available. Families should be educated in the stages of dementia and how it may affect their loved one's ability to interact with them. It is important that the healthcare team clearly communicates the progression of the disease and how far gone the patient may be cognitively in order to give the family member a realistic mindset. As the disease progresses and cognitive decline increases, family members will need to be much more attentive and will most likely need to provide full-time care as is laid out by the Alzheimer's Association. The family's spiritual and religious beliefs should be taken into consideration and respected. Culture may influence the family's approach to end-of-life care. The family should have prior knowledge of the individual's preferences in end-of-life care in case they're not able to make the decisions themselves, and they should understand their legal authority in decision-making as the patient may not have the ability to make decisions for themselves. Okay, now recommendation for interprofessional communication. There should be a team approach. The entire team should communicate regularly to ensure that all members are aware of the patient's current status and preferences, especially if changes occur in their cognitive or physical abilities. Family education is important. The interprofessional team should educate family members about dementia, the end-of-life process, and available resources. Interprofessional team members' roles. The primary care physician is typically the one who provides the diagnosis as they are in the best position to notice changes that may indicate dementia. They're typically the ones who determine the stage of the dementia and diagnose the type of dementia. The primary care physician must effectively communicate this diagnosis with the patient and their family. They provide post-diagnosis management and person-centered care and must coordinate care across health sectors, community services, and health professionals. The neurologist specializes in the neurological aspect of dementia and helps with diagnosis, symptom treatment, and insight on disease progression. They make recommendations on how to maintain brain health, such as physical exercise and a healthy diet, as well as providing safety guidelines to help stop things like wandering or falls. Neurologists offer prognosis on disease progression, inform other team members on the rate of cognitive and physical deterioration, and should address advanced care directives and advise family and caregivers to seek legal counsel. Nurses have direct contact with the family and offer continuity of care. They assess daily living needs, monitor symptoms, and educate families on dementia progression and care techniques. They create the care plan and establish a daily routine and help with things such as hygiene and eating. They assess patient safety and manage behavior problems. Nurses are also a big part in encouraging socialization with friends and family. The palliative care or hospice specialist job is to focus on providing relief from symptoms and improving quality of life for individuals with advanced dementia. Palliative care is appropriate even before the terminal stage, while hospice care is typically for those at the final stages of life. At EOL, the focus is on symptom management and quality of life. Palliative care providers specialize in identifying the source of discomfort and treat appropriately to prevent under or over treatment. Social workers offer psychosocial support for the patient and family and provide emotional guidance. They explain resources and help the patient and family find useful services. Social workers can help the care team find strategies to improve the patient's quality of life. They often help the family understand and communicate patient preferences and facilitate conversations about financial, social, and emotional aspects of caregiving. Communicating with dementia patients. According to Monty, when communicating with a patient who has dementia, the healthcare team member should communicate in a way that will not distress the patient. This can be done by maintaining eye contact and direct one-on-one interaction. Being patient and offering assurance when the patient makes mistakes or feels embarrassed, asking clear and simple questions requiring yes or no answers to minimize confusion, and don't interrupt or argue and engage in conversations in quiet spaces without distractions. Some specific considerations for end-of-life care planning communications are involve the person early in decision-making, use supportive language, be honest but gentle, address emotional and psychological concerns, and empathize with family members. Next, we have specialized care therapy. Occupational therapy is one form of specialized care that can be helpful to dementia patients. Dementia patients must adapt to their changing abilities. As their dementia progresses, patients lose the ability to perform daily tasks. Occupational therapists help families and caregivers find ways to make the environment more supportive. This may include the use of adaptive equipment such as weighted blankets or assisted feeding tools, or arranging the living space to minimize risk and maximize comfort. Occupational therapists focus on comfort and safety. They help with positioning and mobility to prevent falls and maintain comfort, offering safe transfers and comfortable positioning of beds or chairs. According to Fjellman, Wickland, Norden, Skelton, and London Olson, physical therapy is another form of specialized care that dementia patients may need. In advanced stages of dementia, physical therapists work to maintain mobility for as long as possible. As the patient becomes more bedridden, PT helps with passive range of motion, exercises to maintain joint health and prevent contractures. Physical therapists also play a role in pain management, offering gentle movements and positioning to relieve discomfort related to muscle stiffness, pressure sores, or other physical symptoms. According to the Alzheimer's Society, speech and swallowing therapy is another tool used in care for dementia patients. As dementia patients reach the end of life, swallowing can become impaired, leading to risk of aspiration and choking. Speech-language pathologists provide swallowing assessments and therapy, teaching strategies to minimize the risk of aspiration. Communication becomes increasingly difficult as dementia progresses, so speech-language pathologists may assist in finding alternate methods for the individual to express needs and emotions, such as using gestures, facial expressions, or augmentative and alternative communication devices. Special considerations for after death and bereavement. There are not any specific requirements for after death when a patient is suffering from dementia because dementia is not a specific culture or group that requires special considerations, although someone who had dementia could have belonged to a specific cultural or societal group that does require specific cultural considerations after death. An example of this is if the dementia patient was also Muslim, then specific considerations such as prayer, washing of the body, and burial procedures that are followed promptly after death must be taken into consideration. Bereavement. Anticipatory grief. Family members may begin grieving well before the actual death due to the gradual loss of the person they once knew. This can complicate the grieving process, so providing resources like counseling or support groups is valuable. After death support. Families may need guidance on what to expect immediately after the patient's passing, both emotionally and logistically. Support for funeral arrangements, legal matters, and mourning practices should be offered. Emotional impact of long-term caregiving. The experience of caregiving, especially over the extended period of dementia, can lead to caregiver burnout, depression, and physical health problems. After death, family members may still carry the emotional and physical toll of caregiving, making it important for healthcare providers to offer additional support for self-care and healing during the bereavement period. And then here are all of my references. Thank you for listening, and I hope you have a great rest of your day.